Alright, so for the next ovarian tumor we should be looking at, we'll get to look at what's known as a Brenner tumor. We have been addressing possible, issues of the ovaries, just bit by bit, but we're actually moving though. So Brenner tumor is actually a type of what cancerous growth that could occur in the ovaries. Alright, it's a Brenner tumor. Alright, so Brenner tumor, just so you know, is a rare type of ovarian epithelial tumor. So it's accounting for about 3 to 5% of all ovarian tumors. Alright, so it's typically benign. That means if it starts growing in the ovaries, there's a low risk of it spreading to another place. It will just remain within the ovary. You understand? So it is okay. It's typically benign, though you can have borderline or even malignant ones, but those ones are very, very rare. You understand? That's just what it means. So histologically, it resembles what transitional. That's what urothelial epithelium. They should be talking about all this histology, which patients don't really need this. Okay. So key features, they are found incidentally. So most of the times, because they are benign, they won't really be causing issues for the woman to report it. So it's when you are just trying to examine the woman, you might just come across it. You understand? So it's most common in women that are 40 to 70 years. It's usually on one side, usually unilateral. Okay. Then it's often small, have the size less than 2%, but can grow up to 30 centimeters. There is 2 centimeters more than 30 centimeters. So this is a histology, which if you are a student, you can pause to look at this, then also look at this. Okay, but for the patients, let's proceed. All right, so if you want to image it, if you want to diagnose it, of course it's imaging, because the ovaries are buried deep in, so you want to do imaging so that you can actually see inside. So you do ultrasound, you do CT scans, you do MRI scans. So clinical presentation. If at all a patient will complain about this, what would they complain about? So pelvic pain, abdominal bloating, a palpable mass, vaginal bleeding. These are the common complaints that they'll complain about. So you can see this is a Brenner tumor. Alright, Brenner tumor on this other side. The other one is a mucinous cystadenomas. That one we'll talk about it differently. Okay. Then treatment and prognosis is just surgical removal. You have a tumor growth, you just have to remove it. Okay. Then malignant ones, of course, you have to now employ all those radiation therapy, chemotherapy, and all of that. So if it is a benign one, the prognosis is excellent. Once you remove it, that's it. You understand? But if you're having malignant one, you have to still do some other treatments for the patient to actually get better.